Hello everyone, today in this video, I and my partner will talk about myopia. In the first part of this video, we will talk about what is myopia, how it's formed and some factors. In the second part of this video, we will introduce several treatments and we believe one of them will become the major treatment in future. So let's begin. Myopia is very common around populations. So what is myopia? We found some definitions around the web page and we come out this. Myopia is a type of refractive error that close objects appear clearly, but distant objects appear blurry. This is a picture of eyeball. So why myopia people can't see things that far away? That's because the light will come through the lens and focus on the retina for people to see. For normal people, the light comes through the lens and bend. It will exactly focus on the retina. So the signals will send to the brain and people can see things. But for myopia people, their eyeballs are too long or their lens is too thick. So when light comes through, it will overbend and the image will focus in front of the retina. So for the retina, they can't get the highest resolution. They can't see things very clear. But for near object, the lens will change shape, so the normal people and myopia people will have the same shape of lens to see nearby object. That's why myopia people can see things nearby clearly, but far objects is blurry. We already know what is myopia and how it's formed in the eye. Next, we're going to talk about the causes of myopia. We come out 3 major reasons for myopia. The first one is hereditary. This means people with myopia, especially high degrees of myopia, their children will get highly chance to get myopia in their young age. The second cause of myopia is eye strain. When people spend too much time on reading or seeing nearby object, the muscle that controls the lens is always intense. So if this time is too long, the muscle can't get relaxed and expand. So the lens will continue the shape that is very thick. So people can't change their lens as they want when they see far away things. That's the way to cause myopia. The third reason is bad reading habit. Some people like to read in dim light or eyes are really close to the book. Those are really bad reading habits because those can cause the eye get tired easily and keep the muscles intense. So after a long time, the muscles can't get relaxed and will cause myopia. Next, I'm going to tell you some factors about myopia. Although myopia is very common in populations, but it may cause more serious problem and make people lose their eyesight. Usually, myopia will show symptoms around age 8 to 12, but it will continue developing before the age of 25. But some people may getting worse even after 25. This is a picture of elementary school students of China. You can see many of them wear eyeglasses. There are some data showing up to 90% of young adults and teenagers have myopia in China. And there are about 95% of 19-year-old young men in Seoul have myopia. Through the data, we can see that myopia is really a big problem of China and Korea. For America, there are about 25% of population have myopia. The different ratio between China and America may be due to the different lifestyle. Eastern world is way worse than Western world. So many people have myopia, but how we treat them? There are two big ways to treat myopia. First is little cost but no convenient, such as glasses and eye contacts. The other way is convenient but higher cost, such as laser surgery or the implantable contact lens. I'm gonna introduce glasses and external eye contacts, and my partner will introduce surgery techniques later. So this is a picture that can show how myopia people see things with and without eyeglasses. Glasses and external contacts have positive side and negative side. First, we're gonna talk about their positive side. Glasses and contacts, they are cheap and they're easy to get. After you seeing a doctor or you walk into a glasses shop, you can buy them. Besides they're cheap, there's no open wound when you wear glasses or external eye contacts, so you won't feel hurt. But there's still some negative sides. Glasses and eye contacts need careful handling and cleaning, and they're not convenient. You need to carry them with you every day. And people may feel dizzy or headache after a long time wearing glasses. When people wear eyeglasses, it's hard for them to do sports such as ski or snowboarding. They need some special goggles with degree on, and those goggles are really expensive. Also, the external contacts may cause eye dryness, redness, infection, and even worse, they will lose their vision. Next, my partner will talk about surgery techniques.
LASIK is the most popular refractive error surgery. During this procedure, the ophthalmologist creates a flap in the cornea's epithelium using either a thin oscillating microblade or an ultraviolet femtosecond laser. Then he or she lift this flap to access the underlying stroma and uses powerful pulses of light from the computer-guided laser to reshape the tissue to cornea can refract light appropriately and correcting the patient's vision. Finally, the surgeon placed the flap back over the eye, where the edges should heal back together. Now let's talk about the PRK. PRK was a predecessor of the LASIK and is therefore a very similar procedure. The primary difference between the PRK and LASIK is that the surgeon uses the surgical brush, alcohol solution, microblade or femtosecond laser to completely remove the epithelial layer of the cornea rather than to create a flap to be replaced after the surgery. This allows the surgeon more direct access in order to modify the shape of the stroma for improved refraction. After the surgery, the surface of the cornea will grow back over the eye. ICLs correct vision in much the same way that external contact lenses do, except ICLs are surgically placed inside the eye, where they permanently improve the vision. ICLs are inserted through a tiny incision in the cornea and placed behind or in front of the iris, and in front of the natural lens. These thin, pliable lenses can serve as the alternative to laser eye surgery procedures such as LASIK, and are often used to correct a condition that laser procedure may be unable to correct, such as the extreme myopia. The ICL procedure produced little to no discomfort for the patient, and it has 95% average success rate. And ICL has ultraviolet light blocking, can help protect the patient's general eye health. And unless the patient decides to remove the lens at some point, ICLs provide permanent refractive correction. Finally, unlike other refractive surgeries, ICL surgery does not cause or exacerbate chronic dry eye, helping to preserve your ocular health. I have to say, no surgical procedure is without risk, but patients rarely experience the complications with ICLs. The first is infection. Any operation carries with it a slight risk of infection. However, if your ophthalmologist follow the appropriate safety protocol, like use the gauze, speculum, and sterilizing eye drop, you should have very low risk of infection. In addition, because of ICLs is much more easier to operate than the LASIK and PRK, so the risk of the infection is much lower than the risk the LASIK and the PRK. And cataract formation is the second risk. More than half of America naturally develop the cataract. By the time they reach the 65 as a result of the aging. But some preliminary research indicated that the ICL may slightly increase the risk of the cataract. If you develop the cataract after undergoing ICL surgery, your ocular surgeon can remove your ICL and fragment your natural lens.
Here are some data we found in two papers that support our idea that we think ICL will become the major treatment in future. The first paper is calculate the rate of losing vision of ICL and PRK and LASIK. The total risk of lost visual in ICL is 1.39%. Under the same calculated condition, the rate of losing vision for PRK and LASIK is high, about 3% to 6.5%. From the chart, we can clearly say that ICL is much safer than LASIK and PRK. The next paper is asking students who wear contacts how do they feel about contacts, and will they consider to do surgery in future. All of them said they had problems when they were wearing eye contacts, and all of them considered about choosing a surgery in future. So these two papers can support our idea that there are populations that want to do the surgery, and ICL have a huge advantage compared to other surgeries. That's why we think ICL will become the major surgery treatment in the future. These are all the resources we used in the video. Thank you.